San Diego County is not changing mask guidelines despite the spread of the Delta variant across the U.S. Good evening, I'm Lindsay Pena.
And I'm Steve Atkinson. The Delta variant was first detected in India and is believed to be the most aggressive and contagious strain of the COVID-19 virus seen so far. In response, the Los Angeles County Health Department is urging everyone, regardless of their vaccination status, to wear masks indoors in public places. Our ABC 10 News anchor Derek Stahl is going in depth on the risks.
Just 2 weeks after California lifted its mask mandate for the vaccinated, LA County is changing its guidance, strongly recommending that everyone mask up in grocery stores, shopping centers, and other public indoor spaces. LA County Public Health says it's all because of a rise in the Delta variant, locally and across the country.
It really is not so much about protecting the people who are vaccinated, but it's about keeping the spread low within the community so it doesn't get to people who are not vaccinated and to people that the vaccine didn't work for. Studies
show the vaccines remain highly effective against Delta, which was first found in India. An English study found 2 doses of the Pfizer vaccine were 96% effective at preventing hospitalization from Delta and 88% effective at preventing symptoms.
So vaccines are working, but for unvaccinated folks, this is probably one of the most dangerous times.
UC San Francisco's Dr. Peter Chinhong says that's because the Delta variant is about twice as contagious as the original version. Contact tracing in Singapore shows vaccinated people can still spread it. And after a few cases at a mall in Australia, health officials there say they believe just 5 to 10 seconds of exposure is enough to infect someone. Experts say the Delta variant uses several tricks to make itself more transmissible, largely because of 7 mutations on its spike protein.
Those mutations allow the spike protein of the virus to better interact with the receptors in our cells. And that better interaction means that it takes fewer of them to get in.
UC San Diego virologist Dr. Davey Smith says once inside, Delta makes more copies of itself than older versions and sheds from the body longer, adding to its infectiousness and probably making it more severe too.
Certainly, studies in the UK, Scotland, India suggest increased probability of hospitalization, but it's still unclear whether or not that means more serious disease.
Across the country, Delta is now responsible for 1 out of every 5 infections, double what it was the week before. In California, Delta is the 3rd most common variant, behind the ones first detected in the UK and Brazil, but experts think it's on track to take over soon. LA County says Delta accounted for nearly half of the recent cases there, but it is more rare in San Diego County. As of last week, San Diego had detected just 16 cases. Derek Stahl, ABC 10 News.
The County Board of Supervisors Chair Nathan Fletcher says that San Diego County will continue to monitor the Delta variant, but as of now, he says the county does not anticipate changing its mask guidance. He said 95% of the infections from Delta, they have been in unvaccinated people.